Hello everyone, this is the Cancer Prevention Seminar, Chapter 12. Today we are going to talk about liver cancer, one important part of our body because we just have one liver. So let's go to the issue related to this cancer that is in the United States is the 55th more important cancer, and then for men, and is not that common for female. Female is down in the 2% of the cancers. But as it is important for men, we have to address this issue, and also because it's important around the world, not just for the United States. It's the 6th more common type of cancer in the world. Half of the cases are in China, and then is related to 2 types of virus, the HBV, hepatitis B virus, and hepatitis C virus, and is responsible for 9% of the deaths in the world. In the United States, it's 6% of death. This is a cancer of the developing countries, not of the developed countries. So the rates in Africa and Asia is 40 per 100,000, and the rates in the United States is 5 per 100,000. Mostly because this type of cancer is related to infections, to inflammation, to a virus mostly. In the United States, it's higher among African Americans and Hispanics. The survival rates in 5 years is 5%, and in great part because it's a very hard to make the diagnosis of this cancer. So most of the time when the diagnosis is made, it's kind of too late. And then that's why the survival rates is so low. It's more common in men, as we saw in the United States, and generally follows cirrhosis of the liver, viral or chemical cirrhosis. 75 to 90%, the type of cancer is a carcinoma, hepatocellular carcinoma. Also in the liver, there are a lot of metastases of other cancers in the body. Remember when we talk about the cancer development, so the cancer is starting in one place and then start growing as a tumor and then goes to the circulation and forms what we call metastasis. That is a branch of the cancer in several other organs, and the main one is the liver. The diagnostic of liver cancer can be done by a computerized tomography or by an ultrasound of the abdomen. Some liver enzymes can be altered. Liver biopsy is another option. In fact, is the final option. Most of the cases are identified with a liver biopsy. The MRI and the presence of a serum alpha-fetoprotein, that is a marker for this cancer, also helps on the diagnosis. The main symptoms for this type of cancer is abdominal pain or tenderness, especially in the upper right part of the abdominal. Remember, the liver is in the right side of the abdomen. So many times we see a person, oh, I have a pain in my liver, and then he is referring to the left. That's not the liver. The liver is on the right, mostly central on the right of the abdominal. Sometimes because of the alteration of the enzymes inside of the liver, there is an easy bruising or a easy bleeding. Many times the abdomen can be enlarged, and as the liver is the one that produces bilirubin, that breaks the bilirubin. So when the liver is sick, the bilirubin is not being broken, and then bilirubin will spread by the blood, and then the person is going to get skin in all his body, and essentially in the eyes. What are the causes of this cancer? Well, we already mentioned about HBV and HCV, but there is something else that can affect that we are going to talk a little more. Alcohol, of course, alcohol is a toxin for the liver. Then we have the Aspergillus niger that produces a substance called aflatoxin that is very cancer producing for the liver cells. Then excess of fat, cirrhosis, and parasites. We will cover some of these. The new thing here is that in the past we didn't have much knowledge about fat and liver cancer. Today we know that if a person's diet is rich in fat, if the person is obese and have a lot of fat, the liver will have the deposit of these fats, and then will affect the cells in the liver, and then we will have what we call a fatty liver that is a precursor of cirrhosis and a precursor of liver cancer. This is the HBV virus. Isn't that beautiful? Even though it's a terrible thing to have in our blood, but the microscopic, electronic microscopic picture is very beautiful. The virus HBV and HCV mostly are transmitted by sexual or contaminated blood. Is when the contamination starts in the infancy or childhood, the prognosis of the disease is worse and the risk of cancer is higher. There is some evidence that the immunization for HBV decreased by 60% the risk of liver cancer. For HCV, we are working on vaccines, but is not frequent, is not present, is not developed yet. But the virus also is spread mostly by blood. We have a concern about HCV because there are more than 2 million people infected, and 1 million of these they are aware of the infection, but only 180,000 look for treatment. And there is a treatment for this nowadays. And the other 1 million, they are unaware. And it can be immigrants, heroin users, and people that don't have health insurance. So the trends in the United States is that is going to have a big toll in our health system, because 317,000 will die due to HCV complications that can be inflammation of the liver, cirrhosis, and liver cancer. But liver cancer would be 194,000 people that will die, and then 198,000 with cirrhosis, and 31,000 will need liver transplant. And this is the situation in the United States. So that is a lower level of liver cancer and HCV infection compared to other developing countries. So let's talk about alcohol. 17% So let's talk about alcohol. Alcohol is responsible for 17% of the liver cancer. And now let's talk about alcohol and liver cancer. There is a 17% increase in risk of the cancer for each 10 grams of ethanol that is drunk per day. So this is complicated because 10 grams is about one drink. And many people argue that you can drink moderately less than 30 grams or 30 grams of alcohol per day and have a better performance of your heart. But when you go over 30 grams, you hurt the heart. But with alcohol, the increase is dose response and in relationship with liver cancer, and it starts at 10 grams per day. The main carcinogenic product or substance is acetaldehyde. The main carcinogenic is acetaldehyde. That is the substance that change the cells in the liver and make them to be more carcinogenic. Also, alcohol decreases the ability of the body to fix the DNA and like to cause apoptosis. And alcohol also produces liver inflammation. Alcohol enhances the presence of HCV in the circulation. Alcohol causes cirrhosis that is related to liver cancer. And the strong evidence is more than 30 grams per day. But there is evidence also that lower levels of alcohol will affect the person. The type of alcohol drinks and ethanol dose for you to have an idea. So 1 ounce of liquor, it has 10 grams of ethanol or alcohol. 1 can of beer, about the same. And have a cup of wine, has almost 9.3 grams, almost 10 grams. And wine cooler, 1 can or 12 ounces have also 10 to 12 grams of alcohol. So if you look at this picture and you see 2 ladies there and 2 eyes and 2 mouths, it means that you have double vision and you might be alcoholic or alcoholized. Okay, this is a joke because this picture is already produced for you to have an idea of when a person drinks too much, more than 30 grams per day, he can have a double vision too. So don't worry, you are seeing double because the picture is double. It's not alcohol. If you see 3 more of those eyes and 3 more mouths and 3 more heads, then maybe you have to check your alcohol drink today. What is the association of alcohol and disease? Some people still defend alcohol, and this guy is trying to sell alcohol. But if we go and if we could label those bottles with alcohol problems, we will have a lot of I put a list of the things that are related somehow to alcohol, like breast cancer, oral cancer, pharynx cancer, larynx cancer, esophagus cancer, stomach cancer, colon cancer, liver cancer, cirrhosis, fetal alcohol syndrome, accidents, homicide, suicide, spouse abuse, child abuse. And alcohol is responsible for 3 million deaths per year. It's too much for someone to claim that let's drink because drinking alcohol is healthful. I don't believe so, and I am totally against it. It's our bias, but I am against it because I have 3 uncles that were alcoholics. One of them died with cirrhosis of the liver, he didn't have time to get a cancer on that. Remember, after cirrhosis, we have liver cancer. Well, who knows if he had that, but he died with cirrhosis. The other was an alcoholic, and he was a smoker too. And he had to amputate one leg. And then when he amputated the second leg, because he didn't stop drinking and smoking, he died during the surgery. And the third guy was an alcoholic also, the third uncle. And he died at old age, by the way. But he had an inflammation of the heart that they call myocarditis. And then the doctor told him, well, if you want to live, you have to stop. If you want to die, you continue drinking. And it's very interesting that alcohol, according to many researchers, would protect against the heart. But in my uncle's case, it didn't protect anything. It caused the myocarditis, and he had to stop. And fortunately for him, he was able to stop because he would die, and his body was able to make him to live a long life. He died with his 90 years old after many years after he stopped drinking. So now we have a video for you guys. Let's watch the video now.
Alrighty, so what we have here is a cross-section of a normal liver. There, it is on camera. You see how its architecture is relatively intact, the color is relatively homogeneous. This is, would you like to hold a normal liver? There you go.
That's a real liver.
That's a real liver. That is somebody's liver, so let's be respectful of that. So this is what a healthy liver should look like. Tara, do you want to hold it?
Sure, it's juicy. I get to say I've held a human liver.
Yes, you have.
Wow.
Okay, so that's, again, particularly notice that the architecture is uniform and the color, and there's a homogeneous quality to it, okay? This now is going to be a cirrhotic liver.
Oh, wow.
Yeah. And these are all regenerative nodules. The liver is full of scar, and it's attempting to regenerate itself, and as it regenerates, it comes up against scar and forms more scar.
How long does this take?
To develop? Mm-hmm. Well, women are at about a 5-time greater risk of developing this. Well, no, it's not the size. It's that you actually lack an enzyme in your stomach to break the alcohol down into a safer compound. And essentially, every woman I've treated that drink like either of you do has some degree of alcoholic liver disease. It's not possible that you don't have alcoholic liver disease. I can't say that you have cirrhosis. Not everybody gets cirrhosis, but I worry that you are at risk for cirrhosis. This is a mess, right? This is probably somebody who died of cirrhosis. And what happens is that not only are you unable to take toxins out of your system, and it can affect your brain, and you can become what's called encephalopathic. You can't build proteins normally. You can't fight. Your immune system doesn't work normally. Blood backs up behind the liver, and you actually develop varicose veins in your esophagus. They rupture, and you can bleed to death in minutes.
I have a story to tell you about one of my patients, John Wong from Hong Kong. This is not his real picture, don't worry about that. But he was diagnosed with HBV positive, as many people in Hong Kong are HBV positive. And the doctor told him, well, don't drink alcohol, don't eat fat, eat a lot of fruits and vegetables, exercise daily, and control your stress. I mean, some of this advice we give to people all day long. But he followed the doctor's advice, and the main thing for him was to skip drinking, because the other were not that hard. After more than 15 years, he was still HBV positive, but he never had any complication, and his liver tests were normal, and he was taking the checkups every year in order to prevent that. As you saw in the video, there is a lot of many people tell that if you drink alcohol, you should not be worried because the liver takes care of it. As you saw in the video, the liver can take care of that, but will pay a price. You see that the liver is darker, is harder, is fibrotic because of his battle or its battle to neutralize, to fix alcohol, to trying to, I believe if you don't have a liver to do this work, we would be killed in a few minutes after we drink. But we thank to the liver that has this function to detoxify alcohol. But it has a price, and to cirrhosis of the liver and ended up with cancer of the liver. Now I have a story to relate to you about John Wong's. John Wong is a patient that I had when I was working in Hong Kong. This is not his real picture. I just got a picture there. But the doctor told him that he had HB. He was positive for HB virus. And then the doctor said, okay, I'll give you some advice. I mean, on that time, once you are positive, the vaccine will not work, and they didn't have any treatment for the disease. And the doctor told him, don't drink alcohol. Fat, avoid as much as possible. Eat a lot of fruits and vegetables. Exercise daily and control your stress. He followed the doctor's advice and had a happy life. His main concern was drinking, but he was able to stop drinking completely. So after 15 years, he was still HBV positive, but never had any complication. And the liver tests that they do, the liver enzymes that we call, were all normal. So now let's go to another important factor, maybe not for us, but well, maybe we have to be careful also. But this happens in tropical countries when they have foods that go bad and then can produce fungus. And this fungus, essentially the aspergillus, will have the property to produce aflatoxins, and that those toxins are carcinogenic, the aflatoxins. Most of these happen with molded foods, and the main foods are cereals, spice, peanuts, pistachios, Brazil nuts, chilies, black pepper, dried fruits, and dried figs. So that's not a good idea to eat foods that are molded. I remember one time I was in Thailand, in Bangkok, and then I was eating with a friend, and somehow they have a fruit that was yellowish, and that normally the fruit was white. And the fruit, I remember the name because it's a delicious fruit, it's called mangosteen. And that fruit was completely, parts of the fruit was completely yellowish, and the taste was a little rancid. And then I was not going to eat that fruit. But my friend said, no, this is good. This is, you have some fungus there that are benefiting to you. And he kept eating this yellow part of the mangosteen, and I said, well, I'm not going to eat that. But who is right and who is wrong? What we know now is that please don't eat anything that is molded, because this kind of fungus might be the aspergillus. It might not be, but it might be. If it is aspergillus and you eat constantly, if you eat one time, it's not going to kill you and it's not going to cause anything. So my friend could be right if he eats once But if you eat every time, if you eat foods that are rancid and molded, you might have a high risk of this, might have a high level of aflatoxins, and this could be a problem. But again, the mold is very beautiful. You see, again, if you look at the electronic microscope, you have this picture. Of course, they use some substance to make it with the pigments, make it colorful. But still, it's a good, it's a beautiful structure, but it's very deadly. Now, going back to the topic that we talked in the beginning, that obesity can affect the liver. When you are obese, or when a person has excess of fat, normally this fat will increase the levels of hormones, such as insulin, the insulin-like growth factors, and estrogen. These hormones by themselves, they increase carcinogenesis. These hormones, besides increasing the cancer producing or the cancer changing of the cells, they produce less apoptosis. Remember, the apoptosis is the cell suicide. So when a cancer starts to get, when a cell starts to get cancerous, the body triggers a system that will kill that cell. This is what we call apoptosis. And this is decreased when a person is overweight. Well, those are very strange news, but the reviews of liver cancer shows that coffee intake decreased liver cancer risk. So why is that? Coffee can decrease the connective tissue growth factor and decreases liver fibrosis. And then it was going to decrease cirrhosis and the incidence of liver cancer. However, tea does not seem to have the same effect. So the mechanism for the coffee effect is not there. Even though statistically or epidemiologically we have this effect, it might not be true, but we don't have yet a very clear picture. They mentioned that K-ol or K-well and cafestol, they are anti-carcinogenics and they are present in coffee. If that's so, the decaf coffee would be ideal. And it looks like caffeine is not the substance because tea does not have the same effect in cancer protection. And so in that way, the researchers are looking for other anti-cancer agents in coffee. But this calls attention that maybe non-caffeine or decaf coffee or other products that have caffeine, if they are decaf, they might have the same effect. Chlorogenic acid and caffeic acid can slow replication of the virus HBV, and some evidence on that. But the mechanism is still not clear. It's clear for me that if I have to drink coffee to prevent that, I will go by decaf. Is coffee still a problem? Well, it still is a substance that is very addictive. It cannot compare to heroin or cocaine or even cigarettes, but is one of the first substances that human beings take as addictive and might be open the way for others. I believe that coffee is a gateway drug, but my colleagues and other researchers will disagree with that. But for me, it's the first thing that opened the minds for other stronger drugs. And is very addictive, or relatively addicted. If you drink 4 to 5 cups per day, you probably are addicted to it. And for you to know, you just stop for a few days. And if you stop and you feel uneasy, you feel a headache, it's very common. When you stop drinking coffee for a couple of days, you will have a headache. You might have other tremors and other symptoms. So if you feel that, it means that you are addicted to it. Coffee also still causes tachycardia and arrhythmia. By myself, I never eat or drink anything that contains caffeine. So sometimes when I have to go for a trip, long trip, and I am the only driver, I need to take a Coke, not cocaine, a Coke, like Coca-Cola. And then, but when I drink that, it makes me awake, alert, and I can drive a little better. But my heart starts pum, 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 and sometimes go more than 100 beats per minute. So I would say those that have already tachycardia, those that have already arrhythmia, it might be affected by coffee. And also if you have, if you drink if you use marijuana also causes tachycardia. So be careful to use those substances and coffee, and be careful when you do exercise and you drink coffee to improve your performance, but it might accelerate your heart too much. Still, coffee is not indicated for people with high blood pressure or hypertension. It's not good for stress, anxiety, and panic attacks. So many people can have panic attacks just because of drinking too much coffee. Coffee drinking also can cause insomnia. It can have problem with your digestion, and is not advisable to pregnant women. So based on that, still I don't advise coffee. Now there is some parasites, not in this country, but mostly in developing countries and where the sanitation and sanitary conditions are not good, that these parasites can go to your system and then cause a problem in your liver. And I will try to read those names, okay? Fasciola hepatica, Fasciolopsis buxi, Heterophyes, Opistorchis sinensis, Opistorchis viverini, and Clonorchis sinensis. When you see the name sinensis, this is referring to China. And the name is originally from China and means from China, sinensis. That can justify the fact that most of these parasites are frequent, are in China, in the rural part of China, and then where the liver cancer is predominant and where this infection by those parasites is very common. Other toxins to the liver are the vinyl chloride, mostly for people that work in processors or industry that produce vinyl chloride, thorium dioxide, anabolic steroids, arsenic, and tobacco. Mostly here of concern is the youth that when I have strong muscles and then they start doing the anabolic steroids, they might set a pace, they might set a pathway for liver cancer in the future. So be careful with that. Other associated risks to liver cancer are hemochromatosis, a disease that we have an overload of iron in the body. It can be genetic or when a person takes too much blood transfusion. Chronic liver inflammation also can lead to that, and autoimmune diseases of the liver. Now let's talk a little bit about China. This is Dr. Campbell. Dr. Campbell was the author of the China study, and he had done a very good study about China and comparing the diseases that are common in China with the diseases that are common in the United States. And I was in this conference and I met with him, and as I used to be working in China and in Hong Kong, I want to take a picture with him. So I went there and asked him, and he said, no problem. But I didn't have a tie and my hair was a mess. So I decided, okay, I better identify myself and put a better hat. But anyways, what Dr. Campbell described was that the casein protein is a promoter of liver cancer. So the mutation, the initiation might be produced by aflatoxin or by the HBV, but the promotion might be related to the intake of casein, that is the animal protein found in milk. Is not a very good evidence and is not being proved or approved by other researchers, but is something interesting. You know that cancer has two phases. The initiation is when the mutation occurs, and then this is happening in chemicals or by chemicals, by radiation, virus, or even the ultraviolet rays from the sun. The initiation is immediate. When the cells are affected by this substance, it can affect the DNA immediately. But the promotion to go from these cells to be developing cancer cells, a cancer cell, it takes 10 years. And then this is going to grow in small, in slow motion. But animal proteins are promoters, and then they help the cancer cells to grow. They kind of activate these cancer cells that were created by the mutation. And to prove that, Dr. Campbell made a comparison with the two types of societies that they found in China. The rich societies are mostly in the east coast of China, and the poor societies are in the west part of China. And then the rich societies are the societies that adopt more of a Western type of lifestyle. And then when they do that, they have also a profile of diseases similar to the Westerners. And then we have, like you see, the main diseases that they found in this study in China was colon cancer, lung cancer, breast cancer, leukemia, diabetes, coronary artery disease, brain cancer, stomach cancer, liver cancer. It looks like all the cancers are there with the exception of diabetes and heart disease. The other ones are all cancer. In the west part of China, they have pneumonia, more infections, intestinal obstruction, peptic ulcer, digestive diseases, nephritis, pulmonary tuberculosis, non-tuberculosis infections, parasites, and rheumatic heart disease. Most of them are related to a bacteria or a virus. So you see this difference. The disease profile is different, and mostly what happened in the rich society is related to their lifestyle, and mostly what they eat, and mostly what they drink and smoke. We will finish this chapter on liver cancer with the verse in Revelations 21st, verse 4. He will wipe every tear from their eyes. There will be no more death or mourning or crying or pain, for the old order of things has passed away. So this gives us hope that in paradise, even if we have to die of cancer, if we have liver cancer, if you suffer, if you have any advanced cancer here, one day things are going to improve, and there will be one time that no more diseases will happen to human beings, because we will be created new, and the virus and the substance that produce cancer will not be there. Thank you very much, and I will see you in the next chapter of the Cancer Prevention Seminar.